Hi guys, this is my presentation on the client that I saw within our community clinic for this year. The client is a female adult with multiple sclerosis who lives with her spouse in a single-story home with a basement. She is currently employed at Concordia University of Wisconsin within the pharmacy department and values her daily activities and independence. She enjoys activities such as reading and hiking. During her OT initial evaluation, she reported a fear of falling due to decreased balance and reported one fall within the last year as she was getting outside of her car. She identifies fatigue as a barrier to sustained activity and typically engages in activities for around 30 minutes prior to needing a break. Observations from this time revealed that she had a shuffled gait and also experienced one loss of balance during a functional task, which she was able to self-correct. During the OT initial evaluation, we completed 3 different assessments to gather information on our client's functioning, as well as areas that the client may be successful and the barriers. This included the Patient-Specific Functional Scale, otherwise known as the PSFS, the Modified Fatigue Impact Scale, otherwise known as the MFIS, and the Timed Up and Go, otherwise known as the TUG. Our analysis of outcomes will be continued on the next slide. As you saw on the last slide, the client had a total score of 6.6 out of 10 for the PSFS, 51 out of 84 for the MFIS, and for the TUG standard, 13.6 seconds to complete, as well as the TUG manual at 15 seconds. These assessment results indicate that the client demonstrates mild to moderate balance deficits. She has decreased endurance, likely due to fatigue and impaired safety awareness. These factors can increase fall risk and limit her ability to participate in daily, meaningful activities. However, her motivation and willingness to participate in OT, as well as her ability to self-identify areas for improvement, indicate a strong potential for functional gains within OT services. Since only fatigue was measured within the assessments, but we know that endurance is impacted by her report of only being able to engage in activities for 30 minutes, I wanted one additional outcome to be increased endurance. We could set the goal that a patient will engage in 45 minutes of seated or standing activities without rest breaks to improve endurance and promote participation in meaningful activities within 6 weeks. We can modify our plan of care and include endurance and energy conservation strategies. Although she is doing this at home, we can implement this within our session. We can have her break tasks down as well as assist her in doing this. We can allow her to take rest breaks or encourage these, and we can also educate her on pacing techniques. So there are a couple other professions that come to mind that may also be of benefit for my client. This includes physical therapy. Although occupational therapy can work on balance, we are working on many other things, and through the treatment we identified some different gait things. So gait training may be of benefit to her. She also did not have a home exercise program, and there is noted decreased strength as evident with the leg swing during our last treatment. Neurology may also be of benefit. I think that this is something I would encourage her to keep in contact with, whether that's 6-month or yearly follow-ups based on their recommendations, but they can continue to observe and manage her MS symptoms. So now we're going to get in and kind of reflect on that treatment that we did. So the implementation of the treatment as well as the techniques that we use kind of go hand in hand. So how did we implement the treatment in a way that was connected to the goals? Well, this can be simply stated by keeping client-centeredness. We kept the client at our focus when we were setting up these goals based on strengths, weaknesses, barriers, things that were meaningful to the client. We did the same thing with our treatment. So for example, we had her going up and down the stairs while carrying a bag to simulate carrying laundry up the stairs, as she's currently not able to do that as she was using a basket. So we adapted the task and modified that to having her carry a bag so that she's still able to do such things. So that was fun to do, but also it ties right into that goal of the tug. It ties into the safety awareness. It ties into something meaningful for her. So that technique would be adapting in that case. We also went into the kitchen and we had her gather the ingredients that she would need to make French toast. While doing that, we focused on her safety awareness. How was she doing that? Was she able to gather the ingredients? And then after we kind of reflected on that process, would it be easier for her to slide things? Would this help improve endurance? We just talked about moving items to, eye or waist level so that they're easier to grab, that she isn't needing her husband's assistance for that, and she's able to do such things safely. Moving on, how does theory guide treatment? Well, theory guides our treatment. I think before we even think about it, we're taught about theory. Are we restoring? Are we creating? Are we promoting? What is our goal? And based on the theory is what we're going to do. And then adapting their treatment based on the client. Did we have to do that? Absolutely, we had to do that. We started with a 4-way stepping task, and I had wanted the client to step over and cross body. That was something that was too difficult. So we just started with the client stepping forward and then to the side. And we had her complete increased repetitions before switching the directions of which she was stepping. So I think knowing your client's ability and just adapting as we go is super important. And now we get to continue reflecting on that process. So what frame of reference did we use? So actually, I would say that this wasn't one or the other, but rather maybe a combination. So for the exercises that we did to improve strength, balance, things like that, I would say biomechanical. For the majority, I would say we used biomechanical to improve strength, endurance, things like that, but also occupational adaptation. We looked at how was she able to do things like putting the laundry in and out of the washer and dryer, gathering ingredients within the kitchen, and then we adapted that. So depending on the activity, it kind of differed, but majority biomechanical with a little bit of adaptation. We know that multiple sclerosis is progressive, so there are areas that we have to adapt, and there are definitely areas that we can restore that function as well. How would I use the practice framework to shape my treatment? So we did just touch on that. I let it guide me. What truly am I focusing on? What is the client's goal? Do they want to be able to do things? She wanted to remain independent. She wanted to be able to continue to do such things for herself. So there I'm looking at promoting, I'm looking at restoring, I'm looking at modifying, and then as well as preventing. I don't want her to have those falls. One fall is one fall too many. So it kind of guides how you treat the patient. And then theory, how does theory guide our plan of care? Well, I think that actually comes first before you even set up the treatment. I think you learn what theory is, as we kind of discussed previously. But understanding what it is and understanding what I want to do would be how it helps to guide. And now we will review overall. From this class, I learned a lot. As a CODA, we treat patients. We don't necessarily evaluate them. I have been fortunate to sit in on the evals with my OT, so I feel like I have gotten to learn some of these processes. But I think that I learned that no client is the same. Oftentimes, we get in the habit of doing ABC with clients 1, 2, and 3, and that's not how it should be. I think another thing is make occupation the center point. It's meaningful to them. It's motivating to them. They want to come to therapy when they're working on something that's meaningful to them. So I think I really learned the importance of occupation this semester, and it's something that I will definitely carry over not only into practice, but also into my field work and communication with other professionals. I think that overall this experience has been wonderful.